Hello, Dr. Rachel. This is Johnny. My question is, 54 years old,
All right.
and I was did some research on the Urolift procedures for the prostate. Last diagnosis, my prostate was like 80 cc's. So I was just wondering what could I do to shrink the prostate so I can open up the vessels or the pathways for the ejaculation and the erectional dysfunctions and so forth and so on. Thank you.
Thank you. No, thank you so much. You know what I appreciate is I appreciate you sharing this, showing your face and letting everybody know, hey, this is something that so many people deal with. So it's just really not that big of a deal for us to be talking about it. So thank you for that. Now, one thing I want to be clear about is I am a board certified family medicine physician and I practice functional medicine. And with that, I am treating these questions as a physician, right? And as a mom and as a wife and as a sister. So I'm giving you not just my medical whatever you want to call it with it, but I'm also giving you just my personal opinion, which I think sometimes is lacking from medicine as we go and we act like robots, but we don't really infuse any bit of our personality. We don't tell you what we would do for our own families. We don't tell you what we would do, what we are doing. We just go by whatever the societies are telling us to do, and I find fault with that. So, a couple of things that you mentioned when you were talking about your question about your prostate. One, you'd let me know that it is pretty enlarged. 80 cc's or an 80-gram prostate, is pretty enlarged. So this is something you've been dealing with for quite a while. But I want to reiterate when we're talking about the prostate enlargement, and you're only 54, so you're young. And if you live to 100, we've got about almost 50 more years of this prostate that we've got to ride out, right? So what we want to do is create and pick an option that really sets you up for success and not potential long-term failure. So me personally, if I don't have any implants in my body at all, and I have nothing against implants, but I always say, what can we do to optimize before we have to do anything like an implant, right? And this is anything from a breast implant to a penile implant to a prosthetic, anything, right? Because God gave us these things, and do we really want to stick something in the body? Without exploring some other options. So let's talk a little bit about my opinion as a physician about the Urolift and my experience with my patients who've had the Urolift. Now, I'll say there are some gentlemen that I know that have had the Urolift procedure and swear by it and think that it's really a positive thing. But I also know some urologists who don't like to do them, who've kind of stopped doing them, and who have gotten in trouble because of some of the side effects that come with it. So whenever you're thinking about doing any type of procedure, and they use the words like minimally invasive, get back to work sooner, in office procedure, you've got to understand that it's still a procedure and there's still things that could potentially go wrong. So let me just put here and share with you my screen. So this is a really good diagram of what the Urolift actually does. So what the Urolift is going to be doing is actually going in through your urethra. So they're entering through the head, the tip of your penis, going all the way up till you reach the prostate level or the prostatic urethra, where the prostate and the urethra are, the urethra is going through the prostate. And then what they are doing are they are implanting these clips into the prostate to kind of prop it open like this. So imagine that the prostate is kind of closed like this, and they're putting these clips in there to kind of stent it and leave it open. All right. Now the problem, and what you'll see if you kind of Google, Urolift gone wrong, or other things other than just Urolift, because Urolift spends a lot of money advertising and trying to get physicians to do the procedure and trying to get you to want the procedure. What you find is that sometimes these clips that you can see here, they can actually become dislodged. And not only can they become dislodged, see these clips here? Let me see if I can write on this. Yeah, see these clips that they're inserting here? These can actually move, they can become dislodged, and they can become uncomfortable. So for me, they've always reminded me of staples. And just putting staples into the urethra in there is a thing, because once they're there, and if they cause issue, now you've got to convince the urologist that it's causing you issue. You got to convince them to maybe go in there and remove them. And then sometimes those clips can actually turn into, needing an actual full surgery to get them removed. So now, like I said, there are some guys who swear by it and some doctors swear by it. But also, it's a really strong reimbursement for surgeons who do these procedures. All the insurance, Medicare pays for it. Everybody pays for this. So you notice people, this is one of the first go-tos. Now, I'm not going to say it's all about the money, but we do have to talk about how much reimbursement is there. So my thing about the Urolift is that it's not as simple as they make it out to be. There are some side effects that can go with it, and it's not one of my favorite preferred procedures to hear that one of my patients is going through. Now, I'm going to take a little heat from the urologists who actually do this, because this is a bread and butter for a lot of different doctors. Now, let's talk about what causes prostatic hypertrophy and what can we actually kind of do when it comes down to it. Now, this is another thing I want to share, because if you look up this and you Google the study, you'll see it right there. This is kind of like a real world analysis of outcomes using hospital episode statistics of the Urolift. And one thing that really stood out to me as I was, doing this and researching and making sure that I'm giving you all of the right information instead of half stuff, is that when they did it at 1 and 2 years, 5.2% and 11.9% respectively. So what they were talking about are the results analysis for retreatment. How many people actually needed to be retreated? And I felt like that was a lot. But when they actually did the in-hospital complication rate, it was 3.4%. I felt like that was a lot too. Because when you think about that 3.4% who was affected, and you happen to be one of them, that's a big deal, right? If you end up having pain every time you urinate, or you're walking around in pain, that's a big deal if you're part of that. So I felt like, even though that they looked at almost 3,000 Urolift procedures from 80 hospitals were analyzed, I felt as though that these numbers were a little high, and I felt as though it was reflective of my feelings towards the Urolift procedure. Like I said, this is just one person's opinion. I'm a family practitioner. I do not operate and perform Urolift procedures. So if you opt for a Urolift procedure, one of the things that you have to do is you have to ask around, ask your buddies at work if they've had it and who did it and how it went, because this is operator dependent, right? It's kind of like driving across country. There are some people that you could put at the wheel of your car and you'll go to sleep and sleep peacefully and know that by the time you wake up, you'll be in one place and not in heaven, right? There are other people that you don't want them driving you across the country or across the city, right? Surgeons are the exact same way. So if you're going to opt for the Urolift procedure, you need to find a surgeon that you can trust and that someone else has signed off on, other than just, you saw them on YouTube or you saw a review about them. You want real live reviews, because once they perform the procedure, whatever happens during that procedure, you're stuck with it. And it can become a lifetime thing. So you want to do your research. So I also want to share with you just kind of a reminder of what causes prostatic enlargement in the first place, and some risk factors. So when we're talking about what causes it, the main thing that we think causes prostatic hypertrophy are hormonal changes. And that's evidenced by the fact that the incidence of prostatic enlargement increases as you age. And as that increases, guess what decreases? Testosterone decreases. So make sure you watch some of the videos that I have on how to boost testosterone naturally. Another thing that causes enlargement of the prostate are fake estrogens or endocrine disruptors. Fake estrogens are stuff that's available in our food, in our drinks, that are surrounding us, in the plastics that we store our food in, even the plug-ins at your mama's house. My mom uses a ton of plug-ins, and I'm like, geez, every time I go in the house, I'm pulling them out because those are endocrine disruptors. Those can interfere. As you inhale them, they can actually interfere with your hormones. So you want to remove all of these types of things from your space so that you're actually operating in an environment that's not fueling inflammation. Another thing that fuels enlargement of the prostate is just good old-fashioned inflammation. What are you doing that's causing inflammation in your body, and what can you do to decrease it? So things that fuel inflammation: sugary foods, stress, not getting enough rest, all of these things, eating foods that you're allergic to, drinking too much alcohol, all of these things can flare up inflammation. So if you eat something or you do something and your joints are a little achy the next day, you don't feel right, you feel tired, that's probably inflammation coming from whatever it was that you did. So you want to actually decrease inflammation. You can decrease inflammation by moving more. You can decrease inflammation by increasing the amount of sleep that you get each night so that it's 7.5 hours, between 7.5 and 8 hours, anywhere between that 6 and 8, and you're okay. You can decrease inflammation by eating the green leafy vegetables, using the smoothie recipes that we talk about. Those types of things can decrease inflammation. Risk factors for an enlarged prostate: aging. We talked about that because as we get a little older, testosterone levels decrease, and oxidative damage, oxidative stress takes hold, and it causes inflammation. It can fuel prostate enlargement. Another risk factor is family history. If your dad, your brothers have had an enlarged prostate, then it increases the risk that you would have one. Another one is diabetes. Diabetes increases your risk for developing prostatic hypertrophy. Another thing is heart disease. But the part of heart disease that might lead to an enlarged prostate or increase the risk are the beta blockers. You remember those blood pressure medicines that we talked about, the Alols, the Toprol, the Metoprolol. All of those beta blockers actually can increase the size of your prostate, unfortunately. And then, of course, lifestyle. Lifestyle is a risk factor for prostate enlargement. So anytime we're thinking about how can we naturally decrease the size of our prostate, decrease the symptoms associated with the prostate, because if we refer back to the question, he's kind of asking about, how can I boost my ejaculate? How can I boost my erections? Because my prostate is enlarged and I feel like these are causing some of the issues. And some other issues related to the prostate: getting up in the middle of the night off a lot to urinate, rushing to the bathroom to urinate, not being able to hold it. Those are all symptoms that are associated with prostatic enlargement. Now, once the prostate is really, really enlarged like that, most doctors will try to put you on a prostate medication. Unfortunately, one of the big ones that we'll put you on is an alpha blocker, which is associated with heart disease. Actually, there was a study that came out about 1.5 years ago that actually really talks about how those medications can actually increase your risk for heart disease. Let me see if I have the study here. If not, I will link to it below. So you got to be really careful with what you're going to do to treat your prostate. So one, we want to improve inflammation. We want to improve overall health so that the prostate inflammation can decrease, so that we're not steadily increasing in size. Two, of course, you want to talk to your urologist. What is he saying? What are some recommendations that he has about decreasing the prostate size? A lot of times it is surgery or a procedure. All of those procedures potentially hold a risk. So what you want to do is focus on a urologist that has a little bit of holistic to them, like maybe he is a functional medicine practitioner, maybe he's an integrative specialist, and as a result of that, he believes in some of the herbal supplements to help shrink the prostate. Remember, Germany, Austria, a lot of European countries, they go straight to some of the herbal supplements before they go to prescription medications to help manage the prostate. That's another thing. The next thing is, what can you do in the natural space, right? We talked about the pumpkin seed oil. We've talked about saw palmetto. We've talked about rye pollen. We've talked about a lot of different supplements zinc, that can help impact prostatic health. But one of my favorite things, and you got to talk to your urologist and your primary care practitioner about it, but prostatic massage. Prostate massage has, for centuries been the way that men managed prostate issues. Prostate issues is not something that's new. What's new is how we manage it. So one, if your symptoms are related to urinating a lot, if that's your major thing, one, is this overactive bladder? Is there some bladder irritation? Because oftentimes that can be traced back to your food. Go back to the video I did on things that will irritate your bladder and worsen your prostate symptoms, like beer, coffee, caffeine, tea, spicy foods, citrus foods. All of those types of things can aggravate your bladder and make some of those symptoms worse. Now, when you're talking about your prostate is enlarged, and as a result of that, you're having issues with ejaculation, well, I always like to show the picture of why it is that this becomes an issue. When we look at the nerves that are kind of associated with the prostate, this is just like a nice schematic of what's happening, right? So you see your rectum and your anus here. You see your bladder and your prostate below it. Well, I think what's important to keep in mind about where the prostate sits and how the prostate is responsible, remember, part of the prostate's job is to be a conduit for your ejaculate, but also to help propel it. It's like part of the slingshot. If your prostate can't spasm and contract, then it can't shoot like a rubber band out. So having prostate enlargement is part of that. Now, I want you to think about massage and what you know about massage, right? Massages, we can do massages for lymph nodes, right? To kind of get the fluid moving out of your lymph. We can do massages to help with inflammation of certain muscles. It helps move chi and energy through different products, right? So that's ultimately why prostatic massage can be so helpful to different gentlemen, is that it can, depending on which direction you choose, whether you're doing an internal prostate massage or an external prostate massage, it can help impact all of this stuff that you see here, right? You see your prostate is the orange thing sitting in the middle, right? You got nerves that run through it. You got nerves that run beside it. You've got nerves that run below it, but also you have intricate ductwork. The intricate ductwork is a conduit. You have two ejaculatory ducts that are in the prostate that can become compressed when you have prostatic hypertrophy, and those ducts become blocked. That's another thing that prostatic massage can actually do, is help. If there's a stone in those ducts, they can help loosen that stone and help make the fluid move through it easier. So before I tried anything else, I would talk to my doctor about prostatic massage and see how they feel about it and if they're okay with you trying it. I would try that. I would try some of the natural things that you now know can help soothe prostatic symptoms. And I would change my diet and add more exercise in to see if those components too can help with prostate inflammation and enlargement. And then if after all of that, your symptoms are so severe that you cannot take it, now you have the opportunity to talk to a couple different urologists about your procedure. The first urologist you talk to, if you don't feel right about it, if you don't know anyone who's used them, if you don't know any of that, I would keep on pushing and go through someone else. Because listen, you only got one shot at it. And if they get in there and can't get something where they need it to go, now you are ass out, stuck, because you picked a doctor that maybe wasn't the best for you. Okay, so I'm hoping that helps.